Hello, hello. Today, we're going to reach into my bag of papers that has just been kind of sitting there gathering a little dust, waiting for their time in the light. We're going to talk about government-regulated rehab. Is it any more effective than doctor-regulated? Do you send rotator cuff issues straight to a surgeon? And is that really the smartest thing? We'll also skim over some new info on carpal tunnel. But first, here's that goes down so smooth bumper music. Okay, hell yeah, we're back. Welcome to the podcast. Today I'm Dr. Jeff Williams. I am your host for the Chiropractic Forward podcast, and you have done the monster shuffle into episode 63, all creepy like. Why does this podcast even exist? Well, we're here to advocate for you, to advocate for chiropractic, and give you some awesome information to make your life easier from day to day. We're going to keep you from wasting time through your week by giving you confidence in your recommendations and in your treatments. That's the goal. This is something I feel confident that we can guarantee you if you listen and stick with it here at Chiropractic Forward Podcast. I'm no guru. I'm no guru at all. But I do believe I was blessed with some amount of just simple common sense that somehow continues to keep me in the game. You are absolutely going to pick up some nuggets that you can use in your own practice when you listen to this show. Now, part of saving you time and effort is having the right patient education tools in your office, tools that educate based on solid researched information. And we're offering you that now. It's done for you. We are taking pre-orders right now for our brand new evidence-informed office brochures available at chiropracticforward.com. My goal is to get enough pre-orders to pay for all of the initial order before the end of March. If you guys will go to chiropracticforward.com, just click on the store link at the top right of the homepage. You'll be off and running. I'm also linking it in the show notes just to make it easy for you. And we can order any of the posters whenever, but I want to get pre-orders in place for the brochure since they have to be ordered in bulk. With pre-orders helping me do that, I can get them ordered at the end of March, get them to me in about a week and a half after I order them, and then get them to you just as soon as I get them in my hands. So, I would guess we'd get them to you roughly mid-April. So if you're Team Chiropractic Forward, go check them out and order them up. I'll make it happen for all of us. I think it's going to be really cool. I'm getting them for my office as well, you see. And I just can't wait to make it happen. They're colorful, kind of eye-grabbing, and I think you're going to dig them. I have a ton more that I'm working on as well, but I'll be using funds from the first batch to fund the next batch of these brochures. And Rome was not built in a day, so I'm told. So cut me some damn slack, okay? Help me out with the first batch, and we'll be up and running. Who knows what we can get done around here, right?
Oh, yeah!
So on to Daco Tog, diplomat of the Academy of Chiropractic Orthopedists. Daco, hell yeah, I'm back to rocking and rolling thanks to the guys down under there in Australia. They are very intuitive and really do go out of their way to make sure you're enjoying the courses and getting what you can out of them. I am getting what I can out of them. Recent courses for me have been acute torticollis in the adult and osteoporotic compression fractures and how to recognize the clues. I dreaded stepping into the whole idea of 300 hours when this all began. I just thought, 300 hours? How the hell am I going to have time to do that? And I just dreaded the idea of adding that much to an already full load of work, family, and hobbies. Honestly, I've said before, it sounds bragging, but I'm trying to make a point. I see 60 to 70 new patients a month. I got a wife. I got 2 kids. I build the live edge furniture we've talked about. I'm a musician on many weekends, and I'm a sculptor and trying to teach myself to paint. And, well, I like to get a little ornery every now and then and actually relax and have a beer here and there on the weekends too, you know?
You need to grow up.
Maybe I do need to grow up, you know? And like I said, I don't say that to brag. And I don't say it to say, oh, look at me, you know. But like I said, I'm trying to make a point. If I can do it, you can do it. And here's the deal. I was always learning and adding and reading research papers and all of that stuff anyways. So I thought I'd take one live class and maybe get some continuing education hours. Hell, I figured I'd sit in a class for a couple of hours and then probably go have lunch with my wife. Yeah, that did not happen. In fact, I'm blaming it all, every bit of it. I'm blaming on Tim Bertelsmann, Dr. Tim Bertelsmann, for getting me into this. He and Dr. Brandon Still are the partners in Chiro Up, and he was teaching a class at the Texas Chiropractic Association State Convention last summer down in Dallas. I saw him in the expo hall when talking about Chiro Up, and he told me to come check the class he was teaching, and I said, you know, I'll check it out for a bit. He said, you'll like it. You'll stay for the whole thing. Damn it if he wasn't right. I mean, honestly, just amazing information, though. It really was. It was that good, and it was right up my alley. And it was stuff that could be used immediately, and I literally feel that way about every class I've had since then. So you see, it hasn't been stressful. It hasn't really been any extra work for me. It's just been enjoyable learning that I would have been doing anyway. So I might as well get something out of what I was already doing in the first place, don't you think? Now, when the hell do I have time to add 300 hours to my plate? Well, I take off about 2:30 on Tuesday afternoon to do a class. I usually take one on Saturday morning when I'm up before the rest of the family. Sometimes I'll take another one on Sunday when the Dallas Cowboys aren't playing. And football season over now anyway, so Sunday classes it is. And that puts me at about 9 hours a week. So easy peasy, you know. If I can get you started, email me at dr.williams@chiropracticforward.com. I'll be glad to give you some advice and some guidance on where and how to get started. In personal happenings, it's been a little crazy around here, as you all might can gather if you have been following along for very long. If you remember, we had a front desk issue back in August, and we just couldn't get the position filled. Well, my amazing wife stepped in. She got trained on insurance, billing, all that lovely mess of crap. And she's literally the smartest person I've ever met in my life. And I'm not saying that just to be nice. She doesn't even listen to this show. So trust me here. And some may question her decision to marry me and her intelligence in making that decision. But I, for one, think she's freaking Einstein, basically. Anyway, that has turned into us getting to work at 8 in the morning, and now, because she's a perfectionist and still maintains her work responsibilities from her other job, which she can do from home, so that's cool. But because of all that, we are literally here until about 8 p.m. every night, and I'm just about done with that, people. Being busy is a good problem to have, but there is a point where it's a little much. I think a nurse practitioner can take off some of the load, and I think maybe bringing in a new, young, hungry associate would be really nice. But while I can talk about evidence and research, I'm afraid I'm not particularly skilled at hiring associates or setting up a medical entity, but that's the direction I'm moving in, because this workload is not sustainable for having a happy life. It's just not. Example, on Wednesday of last week, in one day as a solo practitioner, we had 14 new patients. Now, 8 of those were intakes from car wrecks, and actually it went pretty efficiently. But you get my point. While it is doable for me, it's not necessarily desirable to have the stress of being piled up on like that. I'm more like 3 or 4 new patients a day, spread evenly throughout the week with some periodic re-exams and a bunch of happy patients just getting better and better every time I see them. And that's my idea of a happy work day. But that's not what we have right now. Good problem to have, admittedly, and I hate to gripe about it. And it's just me and you talking here. So good problem to have, absolutely, but still stressful. We're hiring right now to help take some load off of my wife, and before long, I'll be turning my attention to integrating if this current business trend continues. And, I'll be sharing my experience as we go through it all because, makes good talking, makes good speaking stuff, whatever that's supposed to mean. Now, let's get on to the first thing here. The first item we're going to talk about is titled, "Is a government-regulated rehab guideline more effective than general practitioner education or preferred provider rehabilitation in promoting recovery from acute whiplash-associated disorders?" It was a pragmatic, randomized controlled trial by Cote, written by Pierre Cote, Eleanor Boyle, Heather Shearer, and a plethora of others. It was published in the British Medical Journal, Open, in 2018, and I got it cited in the show notes for all you curious ducks. The reason they did it, they wanted to evaluate the effectiveness of a government-run rehab guideline when comparing it to education and activation by general practitioners and to a preferred provider insurance-based rehab program on self-reported global recovery from acute whiplash-associated disorders, grades 1 through 2. As mentioned in the title of the paper, it was a pragmatic, randomized controlled trial. And here's what they found. Quote, "Time to recovery did not significantly differ across intervention groups. We found no difference between groups with regard to next specific outcomes, depression, and health-related quality of life." End quote. There you go. I'm not adding anything to it. Go look up the paper. Now, item 2. This one is called, "What happens to patients when we do not repair their cuff tears? 5-year rotator cuff quality of life index outcomes following non-operative treatment of patients with full-thickness rotator cuff tears." 'Twas written by R.S. Borman, K.D. Moore, R.M. Hollinshead, and a gaggle of others, published in the Journal of Shoulder and Elbow Surgery in March 2018. Why they did it? They wanted to look at the 5-year outcomes in patients enrolled in a non-operative rotator cuff treatment program. And, basically what happened with those people. And the way they did it is they took patients with chronic, defined as greater than 3 months, chronic, full thickness rotator cuff tears on MRI that were enrolled in the non-operative study. From 2008 to 2010, they started a non-operative home-based treatment program, and they were followed up with after different time intervals. And so what they found, check this out, at 5 or more years follow-up, approximately 75% of patients remained successfully treated with non-operative treatment and had a quality of life score of 83 out of 100. Between years 2 and 5, only 3 patients thought to have a successful outcome actually regressed and had to have surgery. Only 3 patients. The operative and non-operative groups at the 5-year follow-up were not significantly different. So wrapping it up, the authors said, non-operative treatment is an effective and lasting option for many patients with a chronic full-thickness rotator cuff tear. While some clinicians may argue that non-operative treatment delays inevitable surgical repair, our study shows that patients can do very well over time. Pow, snap, bam, smash, kapow.
Oh, yeah.
I don't know why I take such joy in seeing that surgeons have less reason to do surgery, but it gives me a tickle in my belly and a warm, fuzzy feeling, kind of like Jameson. Who wants a hug, people? I'm feeling the spirit in here, Now, item 3. Our last item here is called the effect of manual therapy, including neurodynamic techniques on the overall health status of people with carpal tunnel syndrome, a randomized controlled trial. Written by T. Wolney et al., published in Journal of Manipulative Physiological Therapeutics, October 2018. Basically, they wanted to check the influence of manual therapy, including neurodynamic techniques, when compared to no treatment on overall health status in those with mild to moderate carpal tunnel syndrome. Again, as the title says, it was a randomized controlled trial, 189 subjects undergoing treatment twice weekly. What exactly is meant by the term neurodynamic technique? Well, have you ever heard of nerve flossing? That's a type of neurodynamic technique. Gliding or sliding the median nerve in the case of carpal tunnel. Tensioning, relaxing, basically. Pull out your Google machine. You'll find some great YouTube examples of neurodynamic techniques to help you with your carpal tunnel patients. Now, what'd they find? The authors were able to conclude the following. Manual therapy, including neurodynamic techniques, had a positive effect on overall health status in the group of individuals with carpal tunnel syndrome. So there you go. There you go. Key takeaways. The government doesn't do a particularly better job than you can do on your own if you're educated and stay evidence-informed. Next thing, even full-thickness tears of the rotator cuff, that doesn't necessarily mean surgical interventions in most patients. Next thing, carpal tunnel surgery doesn't require surgical intervention in most mild to moderate patients if you learn some take-home exercises and implement neurodynamic techniques. And last point, surgeons are going to need to start downsizing those houses and maybe forego buying that private plane, as looks like they're going to be less and less busy in the years to come. At least I hope so. The musculoskeletal, the spinal guys for sure. Again, before you disappear this week, consider going to chiropracticforward.com and clicking on Store, the store link, and pre-ordering our spanking brand new evidence-informed brochures. We're looking to gather up pre-orders and ordering all of them in bulk around March 29th. We would appreciate your help in making this happen. Team Chiropractic Forward, people. The message, as with every single week, I want you to know with absolute certainty that when chiropractic is at its best, you cannot beat the risk versus reward ratio. You know why? Well, that's because spinal pain is primarily a movement-related pain and typically responds better to movement-related treatment rather than chemical treatments like pills and shots. When compared to the traditional medical model, research and clinical experience show that many patients get good or excellent results through chiropractic for lots of stuff like headaches, neck pain, back pain, and joint pain, just to name a few. Chiropractic care is safe and cost-effective, can decrease instances of surgery and disability. And chiropractic normally can do this through conservative, non-surgical means with minimal time requirements or hassle on the part of the patient. And if they develop somewhat of a preventative mindset going forward from initial recovery, chiropractors usually can keep it that way while raising the general overall level of health. The key point, if you don't remember anything else we talked about, is that patients should have the guarantee of having the best treatment offering the least harm. And that's chiropractic, folks. Send us an email at dr.williams@chiropracticforward.com. Let us know what you think of the show. Tell us your suggestions for future episodes. Feedback and constructive criticism, it's a blessing, and so are subscribes. So are excellent reviews on iTunes and other podcast services. By now, you know how it works. If you like something, it only takes a few seconds to help us. Help us get to the top of the podcast in our industry, and that's how we get the message out. Can't wait to talk to you again next week from the Chiropractic Forward Podcast Flight Deck. This is Dr. Jeff Williams saying upward, onward, and forward.
Be sure to find me on social media sites such as Facebook, Twitter, LinkedIn, and YouTube. While you're at it, give us a thumbs up on YouTube. That's super simple. Be sure and visit chiropractic4.com. Give our podcast a listen. Lots of wonderful, wonderful information there. And as always, thanks for listening. We'll see you next time.